Hey guys, this is Dr. D with XSculpt, and I'm here to talk to you about an exciting new service coming to our clinic. As men age, we have the propensity to get receding hairlines and thinning hair, and this is just overall frustrating. But with a new service that's coming to us called Follicular Unit Extraction Hair Transplantation, we are offering a minimally invasive way to correct these annoyances. Follicular unit extraction is a minimally invasive, targeted extraction technique where individual follicles are extracted from high-density areas of our head and transplanted in very specific and intentional and artistic patterns to augment receding hairlines and give our hairlines a full sense of thickness. This has a lot of really beneficial units. This is a local procedure. This is a procedure that, when all healed up, provides minimal scarring because each of the extraction points are pinpoint incisions and extraction sites. So at the end of 3 to 6 months, you end up with a fuller and thicker head of hair without visible scarring. This is in contrast to follicular unit transplantation, where a patch or a stretch of skin is extracted from the back of your head with high density hair follicles and then is again retransplanted. This unfortunately leaves a visible scar and requires some sutures to close the skin. What happens the day of surgery? You'll come in, our team will design on your hairline and plan for extraction. We'll numb up extraction sites and your recipient sites with a local numbing medication. You don't require any anesthesia apart from the local anesthetic. At the end of 6 months, you can have a customized head of hair with follicles matching the projection and trajectory of your previous or newly intended hairlines. And so we're very excited to come and have you see us in our clinic for a consultation, and we're happy to talk to you about the finer nuances of follicular unit extraction transplantation.